Many animals die from preventable diseases due to inadequate care and knowledge. As the popular saying goes, knowledge is power, but the ability to effectively disseminate knowledge holds greater power. This is the mission of the Livestock Disease Surveillance Knowledge Integration Lidiski project, a key initiative in the agricultural sector. Sponsored by the European Union, the 5-year Lidiski project designed to strengthen global capacity to prevent and control diseases such as peste de petits ruminants (PPR) and Newcastle disease held a closeout meeting in Abuja on Thursday, November 14, 2024. The project was implemented by a coalition of renowned organizations such as the National Veterinary Research Institute (NVRI), the French Agricultural Research Centre for International Development (CIRAD), the Italian Health Authority and Research Organization for Animal Health and Food Safety of Venice (IZSV), and ICORE, an international development organization based in Nigeria. In her welcome remarks at the Lidiski meeting, Miriam Mohammed, the CEO of the National Veterinary Research Institute (NVRI), shared the achievements of the project, especially the impact on smallholder farmers since its launch in 2019.
This has been a truly collaborative effort, and I want to take this opportunity to thank each and every one of you for your dedication, your expertise, hard work over the course of this very engaging research initiative. Our most appreciation will go to the European Union through the Desira Partnerships for Innovation, which has provided funding and support for the implementation of this project. Also, like I mentioned, our livestock farmers around the 3 states who provided us access to their farms, to their animals, to collect samples, to continue to go back to them each time we need samples or to administer questionnaires. This project has strengthened my belief in the interdisciplinary collaboration and that forms the bedrock for future research and collaboration between public, private sector, and international development partners. The Lidiski project has truly contributed to efforts towards developing and sustaining national disease animal surveillance and reporting.
The Special Assistant to the Honorable Minister of State for Agriculture, Dr. Aliyu Abdullahi, represented by Mr. Aminu Oluwafisayo, also stressed the pressing issues of national food security and agricultural sustainability.
Together, we have deepened our understanding of the PPR and Newcastle disease and developed effective strategy for their control and prevention. Of emphasis are the development of guidelines and protocol for disease control and management, enhancement of disease detection and reporting capabilities of field surveillance officers, particularly in Kano, Plateau, and Bauchi states, and capacity building for veterinary services delivery and livestock stakeholders, among others. These efforts directly contribute to the President's vision of building a food-secure nation, where agriculture serves as a pillar of economic stability and the foundation for improved nutrition and health for all Nigerians. Ladies and gentlemen, while this project marks an important milestone, we acknowledge that our journey is far from over. The path ahead calls for continued collaboration, innovation, and sustained effort to support food security, enhance livestock health, and create sustainable agricultural practices that benefit all Nigerians.
Arnold Batai, the Lidiski project coordinator, summarized the project achievements and efforts to boost vaccine accessibility. He noted that over 2 million PPR and ND vaccines were distributed to remote rural areas while maintaining cold chain standards, supported by the installation of solar panels at the NVRI headquarters and 5 outposts.
So we are working on 2 diseases, PPR and Newcastle disease. We have a main objective which is integrating knowledge collected from actors in the animal health sector to provide tools and know-how to implement sustainable surveillance and control strategies against those two livestock diseases. We wanted to improve or contribute to improving the livelihood of smallholders. And how to do that is by improving the surveillance and control of livestock diseases that are impacting them, mostly PPR for small ruminants and Newcastle disease for poultry. How were we planning to achieve that? It's by three main types of actions. One was improving the capacity of the animal health sectors. The second was to improve our understanding of the epidemiology and the socioeconomics of the two diseases. And third one, to improve the engagements of their communities in those actions. And from these, building tools that can be used to scale up all these new strategies for control and surveillance of the two diseases.
Mrs. Lawal Jesutomi, Communications Officer of Ikore International Development Limited, highlighted the improvement of the livelihood of livestock farmers, especially providing innovative solutions for farmers in rural areas.
So Ikore is a development consulting firm. We profile innovative solutions to social and enterprise development challenges. So we make market work for the poor. We focus attention on the poor, those at the bottom of the pyramid, to make sure that the efforts they put into labor and production, particularly in agriculture, we ensure that the level of effort they put in gives them the right livelihood that they should have. So we profile solutions improving their livelihood. So that's what we do. And Lidiski gives us that wonderful, platform. Gives us that wonderful platform to be able to improve the livelihood of livestock farmers, So we realize that, they put in so much effort, raising these animals, particularly in their backyard. So they put in effort raising these animals, but for some reason the animals die and they don't know what to do. So we try to see what are the gaps, what are the drivers of these challenges. So we realize that the veterinary support in Nigeria doesn't get to that level in the rural areas. So many veterinarians are in the urban centers, and these farmers are not able to come to the city, to get help for their animals. So we have to think about a solution, like what we do. We profile innovative solutions to address challenges that we realize that is causing poor livelihoods. So we try to find a way, and that brings the community animal health workers program to play. So we get community animal health workers, indigenous of those communities themselves. We get them, we train them, so that they go into their communities and give the health service that these livestock farmers need.
The project, which raised awareness among over 222,000 smallholder farmers across 3 states, educating them on disease prevention, vaccination schedules, and the importance of early reporting, seeks to continue to dig deeper into the rural sector. In an interview with Dr. Bolajoku Bashir, epidemiologist and director of diagnosis at NVRI, he emphasized the need for animals to be vaccinated properly, raising more awareness among farmers on the importance of proper livestock care to prevent diseases.
The mission is to ensure to work towards safe animal health population. And so if we achieve safe animal health population, then we're also improving food security as well as building on the health status of the human population. So we are engaged in vaccine production, in research into animal diseases and control, and then also in providing knowledge sharing by way of extension, veterinary extension to rural farmers and as well as peri-urban farmers. So what we are involved in is research into epidemiology. Epidemiology is the study of disease. So if you understand the epidemiology of the disease, how it comes to be, then you are able to identify the easy, affordable, sustainable way of breaking that link so that the disease then become non-issue. So if you are able to do research into animal disease, how it comes to be, then you are able to also prefer a sustainable way of controlling it. However, we have vaccines for some of these diseases, and the best way to prevent disease, as you know, prevention is better than cure, is to vaccinate. However, for diseases that we don't have vaccine for, we are always engaged in disease surveillance. Disease surveillance is how you investigate what is happening by way of disease. So we have, for disease surveillance now, we have the passive, we have the active. The passive is where someone like you, maybe you have a poultry farm. I know Dr. Balaji Kwenevia, you give me a call, I have a problem, we come to investigate. We come because you called us. But active is we are going out to find out what is still the status of this disease. Is this going down? Is it increasing? If it's going down, what are we getting right so that we can continue doing that? If it's increasing despite our efforts, what do we need to do differently or improve on that can help us nip this disease in bud and control the disease?
According to Mr. Tancred Voitouhe from the French Agricultural Research Center for International Development, CIRAD, Nigeria can further prevent livestock diseases by following recommendations and taking actions that can be carried out to tackle the ongoing situation.
Good afternoon, good morning. My name is Tancred Voitouhe. As you can hear, I'm French. I'm an economist working for CIRAD. And my work in this project was to structure and write down the main recommendations based on all the achievements of this project called Lidiski. There are three basic recommendations. One, which can seem a bit technical, is to involve more and better what we call community animal health workers, which are likely and capable to provide, in particular in remote areas, the vaccines, but also the health services that farmers are in need of. And sometimes private vets do not access these areas because they are remote. The market might be too small for them to make money, and or the official veterinary services are a bit far to get first-hand information on what's going on. So they are super critical cornerstone in the ecosystem of vaccination and surveillance and control. So our finding is that there are ways ongoing to involve them further in the surveillance and control of these diseases, and we have recommendations to make this even better on providing knowledge, providing equipment to these people, providing solar fridges, and providing them feedback as well, because they're supposed to monitor affected cases to send them on to officials in official labs, and then they need to get a feedback of how much affected diseases are to be treated or not. So this is one way of improving. The second is to have more evidence-based policies, to have more knowledge, more data. How many affected cases? Are we sure? Where are they located? Or is viruses, or are viruses moving from one place to another? And like this, we're capable to design what we call risk maps. What is the risk of occurrence of an outbreak? And the thing is to avoid treating diseases once they occurred, because you cannot do much and you lose money and you lose time and you lose capital. But to have a preventive not a mitigation, but yes, to avoid the outbreak. And to avoid the outbreak is to make it happen, you need to have a sense of where the outbreak is likely to occur. And once it has occurred, how to buffer the spread of the disease across states. So this is the second direction we suggest, and we have practical means for that.
The close of the event witnessed recommendations, a panel discussion which addressed removing barriers to scale up and sustainability, featuring representatives from the public and private sectors and project partners, PPR, vaccination and the road towards disease eradication, all in line with the ultimate goal of the Lidiski project. Reporting for Signature TV, I am Tom Sinime Natus.